Bismillah ar-Rahman ar-Rahim. Our case today is very interesting. It is 25 days old girl, ex-preterm, 35 weeks, twin 2, low birth weight, 2.4 kg, presented with history of the cough, fever, respiratory distress like pictures due to contact to sick patient with upper respiratory tract infections. On examination, this is the history. Examination, baby looks ill, tachypnic, distressed, respiratory rate is 65 cycles per minute. This is a vital sign. Temperature 36.7 and heart rate 160 beat per minute. Chest examinations, there is decreased pre-thumb, bilateral, and basal crepitation. Basal crepitation, cardiovascular S1, S1, S2 within normal, soft systolic murmur. Abdominal examination, abdomen soft, relaxed, no hepatosplenomegaly, and CNS, baby is active and reactive to handling. The assessment and evaluation after history examination, this baby is late preterm, 35 weeks, low birth weight, 2.4 kg, RDS, late onset neonatal sepsis, bronchiolitis. What is the plan? Septic for sepsis, septic workup taken and started antibiotic ampicillin and oxycillin. And regarding to respiratory assessment, we send for RSV and came RSV positive. Pneumotest of viral study was negative. RSV positive, what are going to do for this baby? Any RSV you have to treat with oxygenation, hydration. So we blood culture came and we discontinue antibiotic. And for cardiac assessment, we request for echo and chest X-ray and ECG and parent counseling. So this is the X-ray. This is the X-ray. If you will see here the X-ray, there is ill-defined patchy opacity seen in the upper zone of the left lung with air bronchogram, donating this pneumonic consolidation associated with accentuation of the bronchosvascular marking, noting on the both lung paracardiac region. Both paracardiac regions. So this is consolidation and the opacities in the upper left lobe. If you will see the hilar here, no hilar masses, and if you look for the costophrenic angle is patent, both costophrenic angle, and the most cardinal feature here, there is Dextrocardia. If you will see here, the apex is pointing to the right side. Here the right side, this is the apex on the right side, this is Dextrocardia. No Dextroposition. Dextroposition, this means the apex, it will be pointed on the left side and the heart will be in the right side. But this is Dextrocardia, this is the apex is pointed to the right side. This is Dextrocardia with normal cardiac shadow and intact bony. If you look for the bones, is intact bony cardiac thoracic cage, and if you see the NGT in the situ or normal position. If you see also here, if there is situs inversus totalis, if this is the liver, you see the liver here. This is supposed to be in the right side, but is the liver here. If the liver shadow in the left side. And if you see here in the stomach pupil actually supposed to be will be here in the left, it was in the right side. This is called situs inversus totalis with Dextrocardia. You have to do ultrasound abdomen looking for the viscera, for the liver, the stomach, and the spleen. It will be spleen and the stomach in the right side, and the liver it will be in the left side. So what this is situs inversus totalis. So what is the situs inversus totalis? This is called mirror image transposition of both abdominal and thoracic organ. So situs, this means the position, inversus, this means inverted, totalis, this means both abdomen and thorax. So this is transpositions, or all organs are transported in the mirror image in normal position. This is called situs inversus totalis. And what is the association for situs inversus totalis? It will be Cartagnar syndrome. It will be any patient with inversus situs inversus, it will have associated with 20% Cartagnar syndrome. If you diagnose Cartagnar syndrome, what is Cartagnar syndrome? This is bronchiectasis, sinusitis, and Dextrocardia, triad. dextrocardia, sinusitis, and bronchiectasis. Any baby having situs inversus, it will be associated with 20% Cartagena syndrome. If there is, you diagnose Cartagena initially, this is ciliary syndrome or primary ciliary syndrome, it will be associated with 50% of the situs inversus. So this is the definitions. طيب, what about the symptoms? The baby will actually asymptomatic. You cannot discover him unless the baby is symptomatic, or you can palpate the apex in the right side and present with complications. So what is the cause of this defect? It will be mutation in the DNAH1 or embryonic dysfunctioning of the nodal cilia, in the nodal cilia. This is the two reasons why it's happening in the nodal cilia or the DNAH1 mutation. How to diagnose this patient? Clinically and imaging study. Clinically by palpation of the apex, it will be in the right side, and also radiologically by X-ray or ultrasound or CT or MRI. There is any treatment for such cases, is no cure for this cases, but the life expectation, if isolated dextrocardia without any defect, without any syndrome, it will be normal lifespan. And also, if you will see the clinical assessment of this patient, 3 to 5% it having functional heart defect. It will be associated with heart defect, and the 25% underlying lung disease like primary ciliary syndrome. So what about the brain? The brain actual affection, it will be heterogeneous asymmetrical brain organization, and it will be right-handedness. It will be, this patient can be actually is left-handed, not right-handed, sorry. It will be left-handed. So any brain affection, this patient can be liable for left-handedness or left-handed. So what is the message from this case? The first message, the dextrocardia or situs inversus totalis can be diagnosed clinically by palpate the apex. It will be in the right side. Actually, maybe it's difficult to diagnose such cases unless the baby symptomatic, and all the time it will be a patient asymptomatic. Once it's be symptomatic and you request it for X-ray, it will discover this baby having dextrocardia or situs inversus totalis. The second message for this case, what is the association of situs inversus totalis? It will be Cartagena syndrome. What is Cartagena syndrome? Bronchiectasis, sinusitis, and also it will be situs inversus totalis. The third message, what is the cause? It will be mutation in the DNAH1 and embryonic dysfunction of the cilia. What about the brain? The patient with situs inversus will be left-handed. The survival can be survived if isolated dextrocardia and no defect or no syndromic. The expected lifespan, it will be normal. ومن أحيا فكأنما أحيا الناس جميعا. شكرا. السلام عليكم.